In this video, I'm going to be sharing with you 5 tips to help you build muscle without triggering back pain. For all you muscle building folks out there, this is a video you're not going to want to miss. Let's get at it. Hey, what's up YouTube? It's Coach Remy here. In today's new video, I'm going to be sharing with you 5 tips to help you build muscle without triggering back pain. These 5 tips are going to involve exercises you should probably avoid, how specific back injuries may affect your training decisions and strategies, and also how to ultimately build muscle without triggering back pain. And these are tips that I learned through my back pain journey, having to implement different strategies and adjusting my training philosophy in the gym, and also strategies that I've used with my clients to allow them to exercise back pain free, and also what I've learned from studying Dr. McGill's research. Quick disclaimer, keep in mind that back pain can be caused by a multitude of factors, and it's always best to seek out a medical professional to figure out what's going on and to rule out any sinister causes. Not everyone may be at the stage where they can exercise yet, and they may need to get the proper treatment first for their back pain, especially if they don't know what's going on before they can take the next step. So just keep that in mind. For tip number 1, we need to figure out what is causing your back pain. So this is where you want to seek out a medical professional and get a proper diagnosis to figure out what is the cause of your back pain. Because firstly, we want to rule out any sinister causes such as a cyst or tumor causing your back pain. But once we get a proper diagnosis, we could then figure out what exercises to avoid and also what exercises to include in your muscle building program that are going to allow you to train without triggering your symptoms. Once we figure out the cause and what the problem is, we can then figure out also what provokes it. So what are your symptoms? Do you have pain with laying down? Do you have pain with sitting? Pain with standing, jumping? All these variables need to be taken into account because that's also going to influence the exercise decision and how we're going to build this muscle building program. So there's one kind of rule of thumb here that I typically use because everyone's symptoms are going to be subjective and different in terms of their severity. So if we look at a scale of 1 to 10, if someone has symptoms of about 1 to 3, these people can typically train with no problem as long as they have the proper modifications in their program. If someone has symptoms of around a range of 4 to 6, they can typically train, but under the supervision, so say of a trainer or a therapist. And then someone that has symptoms that range from 7 to 10, these people probably aren't in a position to do much, and they probably have back pain waking up in the middle of the night. They can't sleep. These people may need to wind down their symptoms first and really just do the basics before they can actually get into a muscle building program. So while this is subjective, it's going to be different for everybody, and sometimes people may feel like a 1 on one day and then they might feel like a 10 on the other day. It's going to fluctuate. So some days are going to be good, some days are going to be bad. But someone that has very severe symptoms may need to wind down their symptoms first. But it's just kind of a little general rule that I like to follow and say implement and to recommend to people in terms of that scale where they're at. And it is subjective in nature because everyone's going to perceive their symptoms a little bit differently and what they can do and go forward. Now, once you know the cause of your back pain and what triggers it, you're going to want to avoid and remove those motions and movements going forward in terms of your muscle building program. So, for example, someone that has a disc herniation that has pain with rounding their back or sitting, we're going to want to avoid any seated exercise or exercises like sit-ups. Someone that has spondylolisthesis or some facet issues, we're going to want to avoid extension. So we have to be very careful with an activity like, say, maybe swimming or something, or if we look in the gym, no Supermans. We got to be very careful with shoulder pressing and anything that may put us into a position where we may fall into lumbar extension. And then if we look at someone with maybe an end plate fracture or Schmorl's node, these people are going to want to avoid excessive loading or compressive loading or any jumping and landing activities, as that can provoke their symptoms. So the whole point there is we need to figure out what is causing it and then remove the cause and then implement exercises that don't provoke the existing issue. And in order to do this, that leads me to tip number 3, we need to get creative with our exercise approach. So to give you an example, we can look at a bent over row. In a bent over row, someone is in a bent over position and they're performing a row. This, for the flexion-based individual or flexion-intolerant individual, is not going to feel too well. So one way we can adjust a bent over row is we can go to a TRX row, which they have a straight neutral position and they're pulling all body weight. Another example could be someone that has extension-based back pain and they have pain with shoulder pressing. We can substitute the shoulder press, the overhead shoulder press, to a landmine press. They have less risk of falling into extension. Someone with maybe an end plate fracture or Schmorl's node, we basically maybe avoid a lot of heavy loading. So we got to avoid heavy squatting, heavy deadlifting, and stick to a lot more body weight based activity that doesn't involve heavy loading of the spine. So those are a couple examples, and we can get into further detail on this, but just you need to get creative with what's going on with your existing back issue and make the appropriate adjustments that allow you to train back pain free. And that involves just getting creative and being smart and strategic with your exercise decisions. And to quickly name off a few other examples that are typically spine-friendly exercises, we can look at the glute bridge, which is a great substitute to the deadlift. We can look at push-ups, chin-ups, which typically tend to be spine-friendly for a lot of people, and that's just based from my own experience and working with clients. Mind you, it's not universal, but those tend to be great muscle building exercises as well. So you just need to get creative, look to other options, find a way that you can train pain-free, and find ways you can adjust the current exercises that you're doing and still create a muscle building training effect. And that leads me into tip number 4. So once we have identified exercises that we can implement that allow us to train pain-free and we're not going to trigger back pain, we can then look into the actual muscle building principles themselves and how we can manipulate them. So when we look at muscle building itself, typically muscle building is caused from 3 factors. So we can look at mechanical tension. That involves the range of motion. So if I'm doing a bicep curl, I have full range here, or we can go partial range. We can also talk about mechanical tension or time under tension. So we can do an isometric hold for 10 seconds or 5 seconds. Whatever it is, that muscle is going to be under tension for that period of time. So typically, the longer it's under tension for, and the greater the range of motion we're moving through, we're going to be training the muscle in a different way that can stimulate muscle growth. Second is metabolic stress. That's that pump feeling that you may get from a burnout. You may do 50 bicep curls at the end of a workout, or maybe 50 frog bridges. That's going to create that pump feeling. So that's our second variable. And then our third variable is just the muscle damage itself. So that can be created by, eccentric contractions typically cause a lot of muscle damage. So when we're lowering portion of a bicep curl, so if we really focus on that portion and we create muscle damage that way, that's going to stimulate muscle growth as well. So those are 3 variables to just keep in mind when you're thinking about building muscle and applying those principles to your exercises that are spine friendly and allow you to train pain free. That's going to be your best way to build muscle while dealing with a current back issue. And one last tip regarding muscle building, the most important and critical factor is going to be a progressive overload. So we have to make sure we're manipulating the variables of our reps, sets, load, rest period, and make sure we're progressively increasing or challenging ourselves through the muscle building program over time. So that may involve lifting heavier weights, doing more sets, more reps, incorporating burnouts, more eccentric contractions. Whatever it is, those variables just need to be manipulated in order to get maximal muscle growth that we may be looking for or trying to achieve. So typically, just from a general rule, 4 to 8 reps for 3 to 4 sets tends to be kind of the standard for muscle building in terms of hypertrophy. So failure and 4 to 8 reps and 3 to 4 sets. But we could also see results and good results with, 8 to 15 repetitions for about 3 to 4 sets. And that's coming out of Stuart Phillips' research and a lot of his work that he has done with his lab. And finally, for my 5th and final muscle building tip, we need to discuss diet and nutrition. So in order to build muscle, we want to make sure we're in an anabolic state. We want to make sure we're in a caloric surplus and that we're getting adequate protein intake for our muscle building goals. So typically the general range can range anywhere from 1.4 grams per kilogram of body weight to 2.4 grams per kilogram of body weight. But it's going to be different for every individual, and some variables are going to involve male, female, your age, your overall muscle building goals, how often you're training per week. Those are all factors that you're going to need to consider and you're going to want to look into for yourself to find out what your adequate protein intake should be for your muscle building goals. But that's just kind of my final and 5th tip for you guys, is to look into diet and nutrition and make sure that you're just in an anabolic state and then you have adequate protein consumption. And before we wrap this video up, just a bonus tip for you guys. There's one other variable and factor that we do need to consider, and that is sleep. If sleep is off, then that's only going to make your back pain worse, and it's only going to make it harder to build muscle. If you really want to maximize your muscle gains and also minimize your symptoms, your pain symptoms, you need to make sure you're getting adequate sleep, and that makes sure you're following good sleeping habits, going to bed at the same time roughly every night, kind of waking up around the same time, avoiding any interruptions, avoiding any caffeine right before bed or in the evening. Those are little tips that you're going to want to implement to help you sleep and get a good adequate sleep throughout the night. Because the better you can optimize that, the better you will feel long term, and the quicker you will make not only a recovery from your back issues, but also build muscle at the same time. So that's my last little bonus tip for you guys. And that's a wrap for today's video. I hope you guys enjoyed today's topic, which was how to build muscle without triggering back pain. And if you have any questions about how to build muscle or how to exercise in the gym without triggering your symptoms, please leave your questions and your comments below this video, and I'll be happy to help you out and have a conversation with you. Okay, guys, I wish you all the best. Have a successful and productive day. Take care.